Hi, everyone. Welcome back to another episode of One Bypass, One Stroke, One Survivor with my father, Bill Dailey. Today, I thought it would be kind of interesting to talk about the first 30 days after his stroke, possibly to benefit folks who have recently suffered a stroke or those who are the loved ones of that survivor. So let's just dive right in. When did you know that you were having it? Like, when did your body tell you I'm having a stroke?
Well, it was purely a guess. I mean, 10 years earlier, I had triple bypass surgery, and unbeknownst to me that I was sick, even that sick. So this time now, 10 years later, I'm also 50 pounds heavier, taking care of myself less or in a worse particular shape than I had been prior to the bypass surgery. I was getting out of the shower, walking into the living room, and all of a sudden my right leg felt as if it was somewhat shorter than the left, and I began to stumble. I reached a chair, sat down, just to kind of assess what my situation was. And
Did you know at that instant?
No, not at that instant.
You thought maybe your feet grabbed the carpet funny?
No, there was something wrong. I knew something was wrong. Okay. There was nothing there. There was no carpet, hardwood floors, and I felt pins and needles coming up from my ankles up to just rising above on both legs. And I knew it was a stroke. I said to myself, "You're having a stroke." I yelled out to my wife, Anna, and she responded, "Bill, what the hell do you want now? It's 7:30 in the morning." I said, "I need help. Something. Please come in here." She came in. I thought I'm having a stroke. I didn't have any of the significant type symptoms that you would, my face wasn't drooping. I thought both my arms were in good shape. I was speaking perfectly. She called the ambulance. As I sat there, they were 2.5 blocks away. That's where they were housed, around from my corner. I was just petrified. Where are they? What the hell's taking them so long?
So you knew right away that you were having a stroke and that you needed medical attention immediately.
Immediately.
And so Anna called an ambulance.
Correct. They came. Asked me the simple questions they normally do: what time the present is, what time of the day is it, what year is it. Responded cohesively, correctly to all the questions. They asked me to stand. I said I don't think I should. They said, "Well, we'd like you to stand." See, I stood and I fell immediately.
And was it your guess that the reason they thought you could stand is because you weren't exhibiting any signs that were sort of classically associated with stroke?
I would imagine so. That's the first thing.
And so what happened when you did try to stand?
I fell down, and they immediately jumped up, got me back in the chair. They realized again, I guess my blood pressure, of course, it was sky high. I'm not sure what the numbers were. I don't remember anybody shouting them out. They put them down on a pad. I guess one of them got on the phone or his walkie-talkie, whatever system he used. I guess they called ahead to the hospital that I was going to go to, alerting them to the fact that they were coming in what they proposed was a stroke patient. And then another set of EMS first responders showed up. They put me on the gurney. We went outside. They put me inside. We left our home, which was about 4 or 5 miles away from the hospital. I remember hearing the ambulance backing up. They took me out.
What was your state of mind during all this flurry of activity around you when you were otherwise just getting ready to go to another rather uneventful day of work? What was your state of mind? You're being rushed to a hospital.
Just frightened, just totally, absolutely frightened out of my mind. Because again, I thought what I was having. I had been in the presence of my wife's grandmother when she had a stroke at our kitchen table, and subsequently lived for almost a month before she finally passed away. That didn't cross my mind then, but I knew how fatal this could be. And we began to go through the doors, and at that point in the hallway leading into the emergency rooms, I just lost track of everything that went on for the next 9 days. No recollection, recollection of what things were told to me.
And so that I was at the hospital, so was everyone. Your kids, Anna's kids, we were literally rallying around you. And I remember standing at your bedside, and you were crotchety and grumpy when you saw me. Not because you were dissatisfied with, unhappy to see your son, but because you didn't like being an imposition. You never really liked being an inconvenience to others. And I saw on your face right away when I stood at your bedside that that is exactly how you reacted. But what was curious is your face was slumping on the right side. You didn't say a word to me. Your eyes were wide open. You looked dead into my face, and you were clearly, were upset that you were causing what you perceived probably to be a hardship on others. And I remember thinking, well, that's Bill Dailey. That's the crotchety, grumpy dude I know when he's being an imposition on others, when he's putting other people at an inconvenience. So I thought, he's fine. Except you didn't say a word. You wouldn't speak any words. And I said, are you okay? How are you feeling? And you just shook your head. And like you just wouldn't contribute to the conversation. And I thought, what the hell happened to you? And your face was, like I said, very droopy. But you have no memory of this.
No.
You don't remember I remember well, all these family members sort of surrounding you right outside the room even. In the ER. I saw you in the ER. You don't remember any of that.
No. None whatsoever.
When did you begin to remember things like... just remember that things were... You do have a memory. Actually, you've shared with me. You have a memory of you were in the hospital, at Inglewood Hospital, within a few days of the stroke, and the Yankees were in the playoffs or something.
Yeah, well, that was written down. That's not. I don't remember that.
Oh, you don't remember
that was
it.
told to me by one of you guys who happened to be in my room.
Right.
You had the Yankee Boston game on.
Right.
It was a playoff game, I presume.
So it was we had logged this in sort of a
Correctly.
diary, and you had read it later on.
Correctly.
I thought that you remembered it. You don't remember that.
No. There was subsequently the only touch with any type of memory of that 9-day hospitalization.
The first, let's call it 2 weeks.
When I mentioned to you, was on another occasion years later, when I was hospitalized at Englewood again. I guess it turned out to be an ear infection or an inner ear problem. It wasn't stroke. I was just very dizzy. Mm-hmm. And the doctor that took care of me, this Dr. Levy, also happened to see me that day. And I do remember in my mind, I said to him, did you ever see me in Morristown when I went to the rehab place? He says, no, I have no affiliation with Morristown. And it was at that point that I said to him, so you know what? I must have remembered him leaning over me during the original hospitalization.
Right.
Because there's no other way I could have, just conjured that up. So it was.
So you have some vague, at best, memories.
That's it.
So after 9 days, let's stay focused on that first 30 days. So you're terrified. Were you? Did you have the? It sounds like you were sort of. I don't know what word to use to describe it. You were getting worse. It sounds like. From the moment you had the stroke to the days that followed, it sounded like the problem became more and more emergent.
Well, initially it did. I read that someone had written that, actually was my wife mentioned to me that I asked the doctor, was I going to die? And his no, everything, you're going to be okay. Mm-hmm. And then whatever was written said, but that was wrong, because as the time went on, your condition got a lot worse. Right. And they were not sure whether or not they were going to be able to save you. And whatever they did to, I couldn't have been treated with the normal clot buster because I had a hemorrhage.
Sure.
I had a hemorrhage. 87% of strokes are ischemic. That would be a clot.
So you were already in an incredibly small category.
Yeah.
Of survivors. The kind of stroke you had should have killed you because it kills most.
There's more people killed of the 12% that have hemorrhagic strokes than the 87% who have ischemic stroke. Okay. So I was in that ballpark.
Right.
However, how I survived, I'm not sure. Whatever it was.
So you went from that 9 days of hospitalization. You got worse before you got better.
Right.
Once you were stable, they were like, get this guy into a rehab.
Exactly.
And so you went to rehab. Did you, at that point, begin to sort of, understand the world around you again? Were you able to form sentences? Were you able to even form thoughts?
No, I don't recall that. I do remember. I'm not sure how long it was, but I know the nurses told me that I was one of the most incorrigible patients that they had. Nothing to brag about, nothing to pat yourself on the back was. I was just foul-mouthed. I remember my Howard Cantor, my therapist, the OT therapist, one day telling me, Bill, on a normal day, we know how you carry on. the old lady that's over there in the wheelchair to your right, to your left, she's a nun. So do me a favor, see if you can hold it back. It was just difficult. For her, I did, yeah. Yeah, I really did. And I do remember now that you had asked myself, the two people that brought me in on the gurney were two older men, and they didn't have me tied down. And while they were standing at the window, gaining information as to what room I was going to go to, I turned to my left and almost fell. They caught me. I was just about to fall off the wheelchair, the gurney onto the floor.
Yeah, I get it. The stretcher that they wheel you around.
Yeah,
right.
And then I let loose. Like you. But I mean,
Yeah,
I
understand.
it just blurted out all over, and so that was one of the problems I had. Remembering it, no, because all of it was those early bouts of being unsettled, the nervousness, the anger, the angst that I had. You guys were able to write it down and memorialize it for me.
And so there you are in the rehab. How soon after you began rehab were you in the throes of therapy? Speech, language,
right.
Occupational, physical?
Right away. I came in the afternoon, I think it was. What they do is, whatever time
So
of day...
you're unable to walk or even sit up, but
no.
they're just putting you right into therapy.
Exactly.
Why is it...
Well, they don't put you in therapy. They'll take the three major therapists, OT, PT, and speech, and each one of them will take a turn in your room. Now, the OT therapist, the PT therapist came in. No, I'm sorry, again. The OT therapist, her name was Holly. She came in, cleaned me up a little, tried to get me put some clothes. When I say clothes, with the gown that they put on you. She remembered. She wrote, because she wrote a page in my book. I wrote a book about my stroke, and she wrote in that book that I said nothing. Nothing I said made sense. They were just words that were blurted out. There was no correlation at all between any of the words. It meant nothing.
So you were just speaking gibberish, and
Exactly.
she was sort of documenting that. Her earliest encounters with you involved you just blathering on nothing.
Yeah. And then each of the other therapists would come in on their own time.
Did you know that when you?
No.
You didn't know that you were speaking in such gibberish.
And I didn't remember them coming in either. I didn't remember until I saw it written down that those three had visited my room. That Howard, who was the physical therapist, had said that we knew we were going to have a hard time if this was going to be successful. The guy weighed 260, number one. We had to have three people move him. He was cantankerous, and we weren't sure how this was going to work.
How long into your treatment in rehab? And again, let's stay focused on the first 30 days. We can address beyond that in other episodes, but how long before, into your earliest treatment in rehab, did you start to sort of recall conversations you could have with yourself? You could form sentences, form thoughts. How soon did that return to you?
I think there was good 4 to 5 weeks, but there were times, there were breakthroughs, such as going to meal management. Meal management was a special day for when we had breakfast, lunch, and dinner, where we were observed, kept away from, not that we were kept away because of disease, but we were kept away from the opportunity to eat in our own rooms. And this room would fill up with patients who had strokes, had throat problems, surgery, whether it was cancer of the larynx, whatever the case may be. We were only allowed to eat with the nurses and the specialists.
Is it because eating food involved your mouth? You could breathe, you could die, you could choke.
And most of us weren't getting regular meals. Some of us were, most of us weren't. Those that were involved in strokes were just fed a repetitive type,
like a very thick
glucose type, if I want to say glucose.
Did you chew, or was it mainly
it was something like you were eating porridge or Uncle Ben's or
something thick that you could eat easily.
And the drinks were also very thick. And of course, they were always afraid of aspiration, pneumonia. They wanted to make sure it went down the right pipe. They wanted to make sure that they looked in your mouth when you were finished, that there was nothing left. That was a big problem.
And talk about your state of mind during this. Like your meals, forgetting about everything else, we could tackle it again, other conversations, but your meals were reduced to those of a toddler.
Right.
What what was that like mentally on you? What kind of how did it tax you? Were you patient with it? Were you patient with yourself, or were you just again letting just the curse words fly? Or
No, no, letting the curse words fly. Very patient with it. I mean, this
patient with them, patient with yourself.
patient with myself, with them. I had, sometimes I would realize, listen, Mr. Dailey, we're going to go to meal management, and I knew what that was for. I vividly remember the room being filled, maybe 13 people. Some of those 13 people, well, those patients, they were all patients.
Sure.
And you had family members, that were there to help because, it was taxing for that many people to be in for the staff, these speech therapists. They don't have
fed you a lot.
You did
in that room
right.
with all those other people,
Right.
Many times because there weren't enough occupational therapists to support all these people who needed help. But by the time I was helping you, you were able to open and close your jaw. You were doing things. You were propped up. I remember you couldn't support your right side at all. There was tons of pillows pushing you to your left, because otherwise you tip to your right. But you were able to consume the food. And I remember that it wasn't particularly unusual either. There was ice cream on the tray. There were foods that you could chew and swallow.
I guess there were. I don't recall too many of them. Ice cream, I don't know why the hell I would remember ice cream, but
I remember it would melt in front of you because you couldn't actually eat it yourself.
that'd really piss you off. Let me tell you something. Me especially.
So you're in that first 30 days. You're eating meals, or you're being taught to eat meals like you're a toddler. You're telling me you're patient, though you are cursing. So obviously your patience sometimes is at its lowest. What about the physical side? Walking again, using your hands again, things like that.
Well,
again, early focus on early. What was it like to know that you couldn't get out of your chair when you wanted to? You couldn't raise out of your bed when you wanted to.
well, you just had to acquiesce. That's all it was. You knew at some point in time. I had been very nasty with the therapist. I was only taking therapy once a day. That's all. I was only allowing it once a day when everybody was getting all 3 therapies in the morning and in the afternoon, and 45 minutes each time. But I wasn't having it. I was in so much pain on my right side that you were with me one time. I remember we were waiting for the food, and I guess I finished my PT or OT early, and I had 35 minutes to kill, and I could not wait. But I was in so much pain for 35 minutes to wait for my meal, which I was really looking forward to.
Sure.
I couldn't wait, and I had to have you took me back to my
your
room.
Right.
There were other times when I remember there was a young man who had his 2nd or 3rd stroke. He was younger than I. I had just turned 60, and he had this latest stroke in Colorado somewhere. He was on vacation. I guess he did some time in like he's in prison. He did time in a regular acute hospital. And then he must have come east because he lived here. And I remember we may have had 10 or 12 stroke patients and a few people, family members there. And he was looking for salt or pepper or condiments. He was looking for some for his plate. But he couldn't speak. His aphasia was terrible. I'm hoping and I'm sure that if he's still alive that he overcame that problem. But nobody through the whole meal and after the meal. I mean, some people had said, well, enough of this, I'm going back. There were some of us that stayed there just to see if he was going to find, if the nurses could find out what the hell it was. And finally, they realized he was saying, Mrs. Dash. And it was like, oh my God,
It's like we figured it
the
out.
Lord is coming. They moved back the stone, and it's the 3rd day, and Jesus is, it was just amazing.
So you can't even communicate that you want a particular kind of seasoning on your food in some cases because you can't express it.
No. Stroke to me, things that have around me have always been, I've always looked at the most amusing side.
Sure.
And I remember another day you came to feed me and had gotten some food for yourself down in the cafeteria.
Yeah.
And probably one of the reasons that I was so sick over the years was I drank a lot of soda. Sometimes up to 12 cans a day. That's insane.
Yeah,
Pepsi,
it is.
Coke.
Yeah.
And you came back upstairs from the cafeteria from getting your own meal, and you had a can of Pepsi. And I wasn't able to say Pepsi. And I just stood there with my tongue probably like that,
Yeah.
drooling. Whether I was drooling or not, I don't know.
Could you laugh at it then? I mean, you're laughing now, but could you laugh at it then?
You did.
Yeah.
I didn't. No.
Yeah, you
No.
couldn't then.
No, I couldn't then, unfortunately.
So that's what I and we can wrap up. We can wrap up. This is a good conversation, and again, I want to have more conversations about just incrementally what it was like, 60 days in, 90 days, and what it was like to go home for the first time, which I remember well was a very emotionally trying experience for you. But those conversations we can tackle separately. What was it like in that first 30 days when you started to get your faculties back? You started to get your cognitive abilities back. Just realizing this was the new normal. What was it like? Share with your audience, viewers of this video, what it was like to just realize that this is the new Bill Dailey.
Oh, I had one. It figures because this is happening more often to me now after this long time. There's one word that I would be able to explain, like eureka.
Mm-hmm.
I don't know whether you think you could go into the area where I'm trying to think of the word I want to say. Epiphany. Mm-hmm. I had an epiphany one day, and this is the one day that turned my life around. That made me realize what I needed. I was getting up to go to outpatient, and I stood up, got up on myself, swung my arms, my legs around, got into the chair, unlocked the wheelchair, and then I proceeded, and I went nowhere. And I looked, was it the telephone wire?
Right. Why are you impeded?
Why
right.
Something's got to be stopping the chair from going.
Mm-hmm.
And I'm looking all over, and I couldn't see what it was.
Mm-hmm.
And at that time, on whether it was my arm, which was on the right side, or somebody else on the left side,
Mm-hmm.
they had a contraption that would slide over the arm of the chair,
Right.
with a groove in it that you could rest your hand.
Right.
Okay. So my hand had fallen out of that. Again, which I didn't feel it, I didn't realize.
You couldn't control your right side at all.
No. And then when I finally realized, well, what the hell could this be? I looked down, and my right arm was trapped between the bed and the wheelchair, and I couldn't feel.
And if you were able to feel, this would be agonizing pain.
Yes.
You were crushing your arm.
I couldn't feel anything, and that's when I realized. And I looked down at that, and I said, well, I guess this is what it's all going to be about. And I got the arm up, moved the chair, and it was at that point, when I said, I had to use the word epiphany, it was at that point that I realized and woke up and said, this is it. This is what my life is going to be.
And so what would you tell, this is a nice way to end, what would you tell folks, viewers of this video, he or she just suffered a stroke, or there's a loved one who's witnessing someone they care deeply about suffering the same, emergency that you did. What would you tell them? What kind of advice could you give someone who's either encountering this themselves for their first 30 days, or as a loved one? More likely, a loved one would watch a video like this. What is your advice to them in that first month of this?
Well, just hover as much as they'll let you. Just give them as much love and attention as you possibly can. If they're older, if they're retired, there's one, and I've gone out. I speak about stroke. We'll go into that later on. I've been out hundreds of times. And I'll never forget, there were two people in particular. When I said to them, when your mom comes home, that's when you got to be the most careful, because now if they live by themselves, now the caregiver and the patient are going to be together. And now the things that your mom used to be able to do, at some point in time, she may get back to doing that again. Mm-hmm. But right now it's going to be difficult, or not at all. We should be able to attain some of the goals she has, mm-hmm. which is going to fall on your father, or vice versa. Men like to drive. Men like to be the bosses. If he can't drive, if he can't nail something, or polish his car, or just do something simple, open a container of milk.
Sure.
There's going to be a lot. And I remember two women. Oh no. They've been married for 45 years. They love each other so much, and I'm thinking to myself, you have no idea what you're going to let yourself in for. Just hover over them, love them, Be attention giving. Don't let them despair. That's the worst. I never allowed myself. I say personally, this stroke was the best thing that ever happened to me, because I'm sure I would have been deceased by now.
Right.
Definitely would have been deceased by now. And I tried to make look at all the bright side things that have happened, the funny things that have happened. So that's just one. If you're a caregiver, try to get over you.
Again, in that first, what do they need to know right away? Because that's probably when they're most desperate for information.
They need right away, number one, to find out from the physician how severe the problem is.
But I mean, right.
Okay?
But I mean to cope with their loved one who's now. I remember seeing you laying in a bed perpendicular to the bed is this way. You're laying diagonally across it. That was crushing to watch, and it angered me that this guy who told a corny joke and was quick to put smiles on people's faces, your customers all those years, was just being relegated to this blob on a bed. It was impossible to reconcile with the person I knew.
Right.
So what do you tell those people in that first batch of days? What can you share with them?
Well, first off, my jokes weren't that corny, by the way.
No.
They were damn good.
Yeah, sure.
Secondly, I can appreciate after seeing as many as I have over the years, what would go through your minds. Mommy's had a stroke.
Sure.
Okay. Nobody knows to this day. It's now 17 years later for me. What stroke? The average guy doesn't know what stroke is all about.
Right.
What does it mean? Right? What do they think it means? It means this. Okay. I mean, they can't do this. I mean, all of those things.
Sure.
Which are frightening. Okay. Frightening. Don't think it's frightening to you because you're watching your parent or your loved one go through this. What about that poor guy who's got a job, who's got a career, who's got kids?
Yeah.
How do they feel? What is their future going to be? You just hold their hand, be there every day as you possibly can, be there when it's therapy. I've asked the nurses this 1,000 times, and they keep on telling me it's part of the HIPAA laws that if you could come in with your own camera and guarantee you weren't going to involve anybody else, if you could take a series of 15-minute photos as your loved one is going through physical therapy, and for your own family, if you've got a sister in Des Moines, Iowa,
sure,
you've got your mom has a sister that lives down in Florida somewhere. Mm-hmm. Show them the progress that's being made. And this was on the 9th of December. We were here with Mom, and they took their first steps.
Sure, yeah, that was, we did that. We did a poor man's version of that. We just documented it in a journal that lay beside your bed. But that was, that is a way of memorializing all of these minor little milestones that, taken one at a time, are minor, but combined, they're extraordinary.
They're masterful, yeah.
Yeah.
It's occupational therapy. Seeing your mom, there was a refrigerator there. There were beds there. You had to make I never made a bed in my life. Yeah. 60 years, I don't know the last time, when I was a kid, just throw the sheets over the thing, You made beds. Yeah. You learned how to use the bathroom during a stroke, how you would use a tub, how you would use a shower. Get involved. Get involved as if you're the instructor. Right. Stay there with them. Right. And let them know, the progress. Let them know the progress that they're making is, and they don't see, they'll see the doctor once in a while, I should say every day. I'm mistaken when I say that. They'll see the doctor. They're not going to ask him early on different questions that you need to be asking. Right. So, you'll be
their advocate.
You need to be their advocate. Yeah. It's going to help you mentally. Your feeling about what that doctor is telling you is going to help them mentally because you're passing on the information. Right. I'm sure there are a million other things I could say.
No, that's plenty. We don't have to get it all in one conversation. But those are good answers. Thank you. So this is a great conversation. We'll do more of these. Again, we'll just unpack these little pockets of time that sort of chronicle the entire recovery from that guy to this guy here.
Okay.
If you enjoyed this video, say so in the comments. And if you have a topic you'd like to know more about that my father can speak to, because the guy's lived it for 17 years. He's completely revised his entire life since his stroke. Say so in the comments, and we'll pull those thoughts from the comments, and we'll actually respond to your questions or any feedback, or any suggestions you have on topics you'd like bill to address.
And I also, my jokes are damn good, so if you want to hear a good joke also.
Yeah, thank you. Thank you for tuning in, and we'll see you real soon.